Food addiction has long been a very controversial topic in eating disorder circles. Most substance addiction centers and specialists think that, oh, this is a concept that makes a lot of sense. People from the eating disorder world who have no addiction training think food addiction is not really a thing. What I mean by food addiction is a subset of people with eating disorders that manifest with compulsivity or sensitivities to certain food substances, usually hyperpalatable foods, foods with high amounts of refined sugars and fats, foods that have been shown to create those dopamine spikes in susceptible brains. So there's a subset of people with eating disorders that has largely been ignored or neglected in eating disorder centers because it's been probably 10 years, 15 years that I've been interested in the subject and talking about it professionally. And I would say only in the last 5 years has it really gained a little bit of traction in the eating disorder world. People who have food addiction, one, need to be identified because part of their treatment is going to need to be teaching them how to have a varied and flexible meal plan that doesn't involve consuming foods that will trigger the dopamine spikes. It's important and essential to distinguish those folks from people with, say, anorexia nervosa restricting type or bulimia or binge eating disorder that do not have food addiction, because for all of those other groups, you really want them to be eating all foods in moderation. But for somebody with food addiction, all foods in moderation could potentially kill them. We have a couple of staff members who have experience and expertise with it. That helps. Sometimes it's a trial. We'll do a trial of a meal plan that doesn't include refined sugars. And it's for certain patients, typically patients with binging behaviors or binging and purging behaviors. The Yale Food Addiction Scale is a useful tool as well to identify people who are likely to have food addiction. And there are certain patient characteristics that correspond to it too, like personal histories or strong family histories of substance addiction, or multiple failed treatments of standardized eating disorder treatment in the setting of somebody who has binging and purging behaviors or binging behaviors.